open without a full license. They can be pending. So make sure that they have had their license, or even once again for detox, longevity. If it's been around for a while, that's a good sign. That's a good sign. They have the right people in place. But yes, you want nurses, BHTs, doctor. What's BHT stand for? Behavioral health tech. Oh, thanks. Yeah. So anyone can, I mean, any of us could probably be a BHT. It's a very minor training, and you work underneath the clinical supervisor. Sometimes BHTs run groups. They do a lot of different, maybe one-on-ones. And it's more of a peer support scenario, or helping in the treatment world. But I mean, they have BHTs in other worlds too. Was there another question about detox? I thought I saw a hand.
I did want to know what EMDR stood for when you asked that, when you mentioned that earlier.
It's emotions. You want to? Oh, okay. It's emotional. I'm looking at Josh. We'll Google that one for you. I don't know all of the letters.
Don't worry.
Does Tim know?
I forgot.
He has a counseling degree too. I'll get that information. Okay. So then we have, I'm actually going to put these three. So these right here, there's outpatient, intensive outpatient, and partial hospitalization program. And these are probably, there's,
movement, desensitization, and reprocessing.
Thank you. Eye movement, desensitization, and processing. Thank you, Tim. Okay, so these three, outpatient, intensive outpatient, and partial hospitalization program. So partial hospitalization program, you'll hear it as PHP. And so these ones right here, this is the problem area, right? Because there's probably, I don't even know, I would say like 20 within a 5-mile radius in Scottsdale. So this is where you're gonna get overwhelmed, right? There's a lot of options. And usually a facility that has outpatient also has IOP and also has PHP. So you'll find the 3 in 1, right? So usually they do it a step down. PHP, and then PHP is 5 days a week, generally for 5 hours a day, sometimes 6. They usually do whatever the hardest insurance company is to bill for. They usually follow that one's requirements, right? Okay, so usually 5 to 6 hours. IOP usually is a step down for PHP, so 5 days a week, 5 to 6 hours a day. They usually, with a facility that has all 3 of those packaged in, sometimes they have housing that is separate from them, but they own it. Sometimes they can live at home. Sometimes they can utilize other housing. And I'm not saying that this setup is bad. This setup is really fantastic, and I would say this is what most people go to, but this is also the biggest revolving door and the easiest to just set up shop. So really you need a license, you need a clinical supervisor, you need a nurse practitioner that specializes in psychiatry, and you're good to go. So these are the ones, if you're looking for PHP, IOP, OP, this is where you're going to want to ask a lot of questions. And those are the questions where we were talking about before. Usually PHP 5 days a week, 5 to 6 hours a day. Then you step down to IOP, which can be a very varied different hours and times. So usually it's 3 days a week for 3 hours, usually in the evening, because at that point they usually have jobs. Sometimes there's weekend IOPs, and they create a lot of different options to be able to nurture whatever life the client is starting to move it back into. And then outpatient, sometimes it's 1, maybe 2 days a week for 2 hours instead of the 3 hours, and they eventually step down. So usually I would say those are all packaged in. There are some freestanding facilities that just do IOP and OP, and they leave PHP alone. But once again, what's going to be a good fit for your loved one? It's all going to depend on that. Location, hours, are they going to stay in school? Are they coming out? Do they need to keep their job? Do they have a family still to report? Support and be there for. There's also There's also online treatment centers now. So you can go from the comfort of your own home, and you're in a group, and maybe there's a trigger behind you, and then you deal with it, process it in the middle, and in the living room. Those are very new, so they do offer those online as well now. Residential. So residential usually is 30, 60, sometimes 45, sometimes 90 days. It can be a varied traits. And what that could look like is PHP. It's kind of the PHP program inside a facility, right? So they're not living off site. So these three right here, they're living either in separate housing and they're coming to the facility. You've probably heard of the Florida model, right? The Florida model. It's pretty much kind of like residential, but not really. They just go to the house that they pay rent for, and they all live together, and then they go to outpatient, IOP, and PHP. Residential is a group happening inside, right? They're not leaving. They have everything they need within the facility. Long-term, so there are some long-term. I actually just talked to a treatment center that they're up to like 18 months. There's a few of them in California. So you can get some really long-term ones. I would say the long-term ones are more for dual diagnosis, right? So if there's other disorders going on that need to be treated. I had a client one time that was in long-term because substance abuse, but then she had schizophrenia too. So she needed more of a long-term treatment center. So depending on what your loved one is dealing with will determine what would be a right fit. The counselor, the pre-screening at the beginning, the counselor really doing that assessment in the beginning will help you figure that out. But this is telling you there's a lot of options out there. And then there's some other programs. These are just, there's some other programs that aren't necessarily this, but there's like wilderness programs. So we have a wilderness program here. There's a lot of them in Utah. I think there's a few in Wyoming. And so wilderness programs are more of survival. You go out in the middle of the woods, you learn how to fend for yourself, you have groups out there. It just challenges your every senses in your body. Like you are just totally in a different location, and you're learning how to really get life skills down to the bare bones. So you learn how to, they have to do their own fires, and then I brought that up, dual diagnosis. So depending on if there is some other issues going on or not, and generally, I would say a lot of the treatment centers deal with dual diagnosis, but you want to work with somebody who, if there is dual diagnosis, they have a psychiatrist that can properly assess the patient, right? So sometimes they'll just give them meds, and then meds for the side effects of the meds. And you really want to get a doctor, a PhD, a psychiatrist that can really properly assess. Because you have a child going into treatment, they've been using drugs and alcohol, you don't really know what's going on. You really don't know. And so to get a psychiatrist that actually listens and will hear all the concerns from point A to point Z and like everything in between, and they're willing to really take some positive, healthy risks to see what's really going on. You're going to really want to find somebody who works with a psychiatrist who's thorough, really thorough. It's kind of a lot of, I will say this, a lot of treatment centers also right now are doing everything. So insurance codes started paying less on substance abuse. So someone who's strictly substance abuse, it is a little less money than somebody who has a lot of other stuff going on. So there's a lot of treatment centers right now that are switching their whole model to substance abuse, and then also primary anxiety, primary depression, primary sex addiction, or codependency. So and I'm not saying that it's bad, but like that spectrum is starting to get a lot wider of who can go into treatment, and it's not so specific anymore. So sometimes you want to make sure that the treatment center, if you want your loved one to go to a treatment center that only treats addiction, you need to make sure that that is where they are. If you're fine with them, that they're going to be in a group with addicts and somebody who has bipolar only, or somebody who has depression only, then you want to ask those questions too, because I would say quite a few of the treatment centers within the last year have switched over to accepting just mental health primary only. So that's another question to ask. And then we also have, and this isn't, so we also, I like to say, we have a few routes to take when it comes to treatment. You don't have to choose the abstinent route. There's a harm reduction route, right? And so it doesn't make it worse. If someone's not ready to get sober and they can't be abstinent for whatever reason, there are treatment centers out there that deal with medical assistance treatment centers. And so MAT, you'll hear them referred to MAT, MAT. And so somebody who accepts MAT, their clients can be on Suboxone, Subutex, methadone. There's different, like microdosing is a new thing that some people do, medical marijuana. So all of those could be potential medical assistant treatment. If somebody is on medication for depression or anxiety, that does not count as that. This is someone who cannot be fully abstinent from drugs or alcohol, and like Vivitrol, that can be considered a little bit. They don't consider that. They'll take Vivitrol at a outpatient IOP or PHP, but medical assistant is really that methadone, Suboxone. There's some smaller forms of it. So if somebody cannot get sober for the life of them, harm reduction may be a route. I mean, it is a possibility. At the very least, we can reduce some harm to themselves and others. Those are out there as well. That's a whole other PowerPoint and a conversation, but we'll just mention it on this one. And then counseling. And so I wouldn't say counseling is necessarily treatment, but it can definitely be the start or towards the end. Continued counseling to bring someone into treatment or then to bring them out is definitely